Well, the start of flu season is here, and it's important to keep you and your loved ones protected this year. A new report from the CDC cites Louisiana as the leading region in flu-like illnesses. So here to talk about how you and your family can stay protected is Dr. Ajsa Nikolic with the Ajsa Health System. Thanks for joining us. It feels like an early flu season this year.
Thanks for having me. It does feel like an early flu season, but remember, flu season can start as early as October. So it's important to get vaccinated the minute those vaccines come out.
So let's talk about the vaccinations or things you can do to help you, to preempt some of these issues that we're going to come to.
So the flu vaccine is probably the most important one, and especially for little children. So it starts at 6 months, and you want to get those children that have never been vaccinated before vaccinated as soon as possible, because they need 2 vaccines a month apart. And then it's also important for anybody who's immunocompromised or older or pregnant. You want to protect kind of our elderly population, our children that can't get vaccinated, as well as our sickly population. And it's all about herd immunity. So if nobody around you has the flu, you're not going to get the flu, right? And the other thing that's important is to make sure you're washing your hands, keeping your distance. If you don't feel well, don't go around spreading the love with all of your germs. Right. You know, make sure you're keeping your distance, washing your hands. Don't send the kids to school sick, especially if they're running a fever, sore throat, cough. That triad's kind of the big one with the flu-like illnesses.
And you know, we talk about flu shots. Some people are a little gun-shy about the flu shot. Kind of dispel some of those myths out there. It doesn't make you sick, right?
No, it does not make you sick. I really don't understand where that worry comes from, because it's not a live vaccine. So it's already been killed, and people can sometimes not feel well after any vaccine because it stimulates your immune system. So it's making your immune system build antibodies against the flu. So if you're already feeling a little run down, you can probably feel a little bit more run down afterwards, but you're not getting the true flu from the flu vaccine. And the flu vaccine takes about 2 weeks to kick in, so you may have already gotten infected before you went to go get that flu shot. And that's a good way to think about it a lot of times. And I tell people, you know, if somebody comes into the clinic and they're already running a fever or not feeling well, no, now's not the time to get the flu shot. You know, make sure that you're feeling well before you go in. But don't delay it. The last thing you want to do is not be ready for the flu when it comes in waves. And like the CDC has said, we're on the front end. In Louisiana, we're starting to see a lot of activity. And
just quickly, for our viewers out there who want more information on the flu shot or what to do if you have the flu, when to see a doctor, that type of thing, where should they go?
So there's a couple different options. We do have virtual visits, such as through Ochsner Anywhere Care. We have urgent care clinics throughout the city where people can go in without an appointment. You can call your primary care physician and see what they recommend for you, because they know you well. You know, the important thing is keep the symptoms under control. So if you have a fever, if you have a cough, if you have a sore throat, if you have not been vaccinated, just stay away from everybody and get that medical help that you need so that you can get on medication. There's a short window of 72 hours that you want to start the medication. Otherwise, it doesn't really help too much. And that medication also doesn't treat the flu, it just shortens the symptoms and makes you less infective for people around you.
All right, well, thank you for that information. Thanks for joining us. I know you've got a busy couple of months ahead of you, but we'll put all that information on our website. Quaylen, Gina.
All right.